The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Can our risk for periodontal disease be predetermined? Based on genetic studies, a simple blood test can help uncover potential problems. For people living with HIV, medication use is crucial. Having a pharmacy specifically monitoring HIV therapy can help with patient compliance. Many women are affected by stress incontinence. Simple exercises with these vaginal weights could help. Dental implants, can they help restore that smile while replacing dentures and bridges? Sometimes cleaning with the proper vacuum can provide a healthier living environment. And for companies who have high-risk employees, programs are being instituted to help save millions. All these topics are next on Today's Health. This program is brought to you in part by Medical Science Systems, Statlander's Pharmacy, Convatec, Nobel Biocare, the Hoover Company, and Johnson & Johnson Healthcare Systems.
Hello, I'm Faith Daniels, and this is Today's Health. Medical research is revealing that many traits are inherent. Today, healthcare workers are using this genetic information to help treat and prevent many diseases, especially when it comes to periodontal disease.
Genes are the basis for a person's physical makeup, and they can have both positive and negative influences. For years, researchers have been discovering the link between disease and genetics. Finding a way to use this information can be advantageous to our present and future health.
Genetic susceptibility testing is a means of going in and defining which specific genetic factors increase your risk and change your likelihood of getting a disease.
Researchers have determined that there are genetic links between certain genes and a variety of diseases. They've also found that manifestations of certain diseases can contribute to other, more serious ones.
556-645.
Periodontal disease, for example, has been linked to more serious medical conditions, such as heart disease and diabetes. Knowing a patient's potential for periodontal disease in advance could help to prevent the complications it can cause.
And unfortunately, you've got some severe gum and bone problems.
Recently, there's been a new discovery in which we have found that there's a certain gene that some people possess that basically makes them overreact to the germs or the bacteria that cause periodontal disease. PST is the brand name for this new genetic susceptibility test that allows us to determine whether or not the patient possesses this gene that makes them overreact to the plaque that causes the disease. The test itself is very simple, and that's really part of the beauty of it, is it's not an elaborate or a very costly procedure. You simply have a little finger stick, just like as we all have had when we were children, having blood taken. And from that one drop of blood, we put it on a little blotter paper, and that paper then is sent to a special laboratory who tests for this gene. Then the results are sent back to our office.
We've got the results from your PST test back.
Periodontal disease is much like heart disease in that your susceptibility for periodontal disease depends on how many risk factors that you have. And since genetics is an important risk factor in this disease, it's very nice that we now can determine whether or not this is one of the factors that we need to include in the equation as we develop the proper treatment plan for the patient.
Health, and that your risk to have periodontal disease depends on a certain number of risk factors. And
the purpose of understanding a patient's risk for future disease progression is to be able to optimize therapy before problems develop. Based on the diagnosis of past disease and risk of future disease, clinicians can avoid undertreatment where urgent intervention is required. It is important for adult patients to use PST results to help them design an effective oral hygiene plan. And having this information can also help children begin an early treatment program that can greatly reduce their chances of developing periodontal disease.
For people living with HIV, having a specialized pharmacy to monitor your drug regimen can have a great impact on patient care. Stress incontinence can affect any woman at any age. How can these weights help? Stay tuned.
For millions of Americans, HIV isn't something to be feared, but an all too real fact of life. On the front lines of this life and death struggle, some moments are better than others, and every day offers new challenges and new hope.
When anyone is told that they're HIV positive, and I don't care who tells them, the information is devastating because a wall of denial comes crumbling down. Everyone thinks this cannot happen to me, but it does happen, and it did happen.
From the moment a person becomes infected with HIV, the virus begins copying itself within the bloodstream millions and millions of times. Though the body fights back with CD4 cells, these cells alone are not powerful enough to slow it down.
Just touch the tongue to the top of the mouth. HIV is a chronic infection. It's caused by the constant replication of the virus. And if we want to be able to get this infection under control, we need to stop the replication of the virus, or at least to slow it down. And we've learned over the last couple of years that the best way to do this is by using several medicines simultaneously. So the whole issue of compliance and adherence, and the proper term is really adherence to the medications, becomes a problem. Because it's very, very difficult to take medicines as they are scheduled. They need to be taken on a regular schedule.
People will fail to follow their medication regimens for many reasons. One may be that they start to feel better after beginning a new regimen and they might get good lab results and think that they're well enough that they can stop. Another reason might be because of side effects. Many experience things like nausea, vomiting, diarrhea.
If you start on the greatest drug combination in the world and you don't stick to it, you've actually set yourself back in a big way because you may have helped the virus mutate. You may have lost the effectiveness of some drugs.
A pharmacist who works with HIV patients can make following directions easier. At a pharmacy that specializes in HIV therapy, you can also get counseling and information that help you to fit the drugs into your situation or your lifestyle. Today's Health found Statlander's Pharmacy, where all pharmacists are certified in HIV drug therapy. Statlander's is the only pharmacy serving over 100,000 people living with HIV. Customized services help patients address their difficulties in taking their medications as prescribed, and the confidential express delivery of HIV drugs is convenient and reliable.
There is a huge benefit in having the patient work with our pharmacists. There's constant interaction with the pharmacists, and as new drugs are developed, we do everything that we can to make sure the patients understand the importance of taking them the right way.
At the end of the day, it's you, it's the patient, it's the person who's battling the HIV who's going to make the decision that I'm going to take this pill at the proper time on an empty stomach or not, or I'm going to try and find my balance or not. And any support that can come in that direction, I think will help the patient improve his or her odds of successfully battling the virus.
Female stress incontinence is a common problem suffered by millions of American women, few of whom ever seek treatment. But frequently it can be cured by a simple program of exercises.
Stress incontinence can happen to any woman at any age, and the good news is that in many cases it may be curable.
Stress incontinence is one of the most common forms of urinary incontinence, and it is urinary leakage that occurs as a result of increases in intra-abdominal pressure, such as what happens when a woman laughs or coughs or sneezes, and she may have a little bit of urinary leakage.
When there is a loss of pelvic floor muscle tone or stability, stress incontinence can occur. The muscles that support the bladder lose their strength and relax, shifting downward pressure onto the bladder.
Causes of pelvic floor weakening can be vaginal delivery, things that cause a constant strain on the pelvic floor, such as constipation. There can be some congenital weaknesses, prior surgery.
Female stress incontinence affects over 9 million women in the United States and 22 million worldwide. However, though it happens to a lot of us, only a few seek treatment.
I would leak urine when I would cough or sneeze. I couldn't control it. It was difficult to hold it back, even though I had just emptied my bladder 10 minutes ago, and all of a sudden I would sneeze or laugh really hard and I would get a little bit of leakage.
There are several treatment options available to women with stress incontinence, including behavioral techniques, biofeedback, drugs, surgical management, and exercise. All of these have varying rates of success.
The pelvic floor is made up of muscles, and like any other muscles, they can be exercised. Femtoned vaginal weights are a safe and easy-to-use training aid specifically developed to help women to identify and exercise the pelvic floor muscle group.
They look like little tampon devices, and they should be placed into the vagina, and a woman should be actively contracting to pull the weight up. And generally speaking, we ask the woman to use the weights for about 15 minutes once or twice a day, and results can generally be seen somewhere from 2 to 3 months.
It's recommended that you start with the lightest weight and work up to the heaviest.
When I first saw the vaginal weights, I thought these little things can actually help my problem, but I was willing to try anything because at that point in my life I was uncomfortable, I was miserable, and I was open-minded to try anything. It's such a relief that I have control of this problem now. I feel more in control of my life, and my lifestyle is much improved. I'm able to exercise without any embarrassing leakage, and I feel like me again, 100%.
Replacing lost teeth always meant getting a denture or bridge.
The idea of wearing a lower denture just absolutely terrified me.
Today, another option is available: dental implants. We'll show you how it's possible to keep that smile next.
A beautiful smile can charm those around you, but for some people, the fear of slipping dentures or falling bridges can make them self-conscious about flashing a toothy grin. Fortunately, though, new alternatives may get them smiling again.
People lose their teeth as a result of poor dental care, injury, or aging, and tooth replacement has always been a serious concern for patients and dentists alike. Years ago, the only option available to patients were dentures and bridges.
If someone lost all of their teeth, they would require a full denture. And a full denture is a piece of plastic, essentially, that's molded to fit to the gums with teeth stuck on it. These would then have to be balanced inside the mouth, and people would chew with them, and as well or as poorly as they can. Some people were able to get along quite well, and some people were unable to use them at all.
I had a problem mouth. I don't know if it was genetic. My whole family has, quote, quote, bad teeth. And we had an uncle who was a dentist, so our teeth were always well taken care of. The teeth just went. So the idea of wearing a lower denture just absolutely terrified me. It made me nauseous.
Today, modern advances in restorative techniques make it possible to offer a system of replacement teeth that look, feel, and function like natural teeth. A man-made titanium root is used that fuses with the jawbone, forming a secure foundation for tooth replacement. Swedish scientist and orthopedic surgeon Dr. Per Ingvar Brandmark first observed this fusion of the titanium implant and the bone more than 30 years ago, and implants placed at that time are still functioning today. Brandmark system dental implants are the most thoroughly documented dental implant treatments in the world. It has received the American Dental Association's acceptance for all treatment indications, making it the safest and most reliable dental implant system available, with long-term results that are well established and published in recognized scientific journals.
I interviewed dentists. I interviewed surgeons. I started reading up on implants, on all the different kinds, and there are many different kinds. Brandmark was the first.
Dental implants actually give somebody a chance to have another set of teeth. And the dental implant supported teeth can be like your own teeth.
Dental implants are not a short-term fix, but a long-term solution. And Brandmark system dental implants from Nobel Biocare ensure safe, reliable, and aesthetically pleasing results, all the ingredients of a successful restoration.
By using the dental implants, we are able to either replace a single tooth with a single implant, leaving the adjacent teeth alone, replace a section of missing teeth with implants, leaving the rest of the teeth alone, or replace a whole mouth with dental implants to have a fixed bridge which would be like the patient's own teeth, or to be used as an anchor to clip a removable prosthesis onto.
They're teeth. They feel like teeth, they act like teeth, they are teeth.
Well, I'll tell you that basic genes are just something to wear.
This has changed my life. I don't have to worry about my lower teeth anymore. I just take real good care of them. And they're my teeth.
If you're on the internet already or you're thinking about it, you'll be amazed at how much information there is concerning your health and well-being. For a good start, visit our Today's Health website at vstar.com. For some people, carpets are more than soft floor coverings. They're the home of germs and other irritants that can affect health. For people with allergies, properly cleaning the carpets is critical to improving the indoor air they breathe.
Whenever you use a vacuum cleaner, the agitator stirs up dust and other irritants lodged in the carpet. Not all of this is immediately sucked up into the dust bag. Some of it gets scattered around the room and into the air.
In carpets, there can be many things that exist. They could be mildew, mold spores, dust items such as the house dust mite, dander from cats and dogs.
I like to vacuum every time I clean. It's important to me because my husband and I both have acute allergies and I suffer from asthma, so dust is not tolerated in my house.
Children are greatly affected by air pollution in their homes by various different ways. Number one, they sometimes will stay longer in the home than adults. Number two, their proximity to the ground makes them more apt to get affected from air pollution that's on carpets and tile.
This Hoover wind tunnel vacuum uses a 6-stage allergen filtration system that traps 100% of dust mites and their eggs and 99.98% of ragweed pollen.
In the past, I've purchased vacuum cleaners and they'd get the surface dirt, but I'd have to go back over them 2 and 3 times just to know that it's clean.
The embedded dirt finder can make cleaning carpets easier. When the unit is no longer picking up dirt in a particular area, a green light will indicate that you're ready to move on.
If it can handle my home, my cats, my allergies, and my hair, I think it's up for any job.
It's best that you keep your house as clean as possible. The most important area to start with is your bedroom, because your bedroom is where you stay sometimes 30 to 40% of your time. Cleaning carpets will generally reduce a lot of the air pollution in your house. Also cleaning tabletops, desktops, and generally keeping the house, and especially the bedroom, as simple as possible.
Millions of people suffer from allergies, and vacuuming is key to maintaining a clean living environment.
After I clean my home and I clean my house and everything is nice and the dust is gone, I can breathe so much better and I feel so much better.
These days, with the cost of healthcare skyrocketing, many people can't afford to get sick. Wellness programs help those at risk make changes in their lifestyles that not only save money, but also save lives.
It's not easy to break habits or make changes in the way we live. That's why companies today are finding ways to help employees stay healthy. The cost of providing health benefits has risen dramatically in recent years, from under $2,000 per employee in 1985 to an estimated $4,600 per employee by the year 2000.
We need to figure out, what are the challenges in this population? Is it high blood pressure? Is it obesity? Is it stress?
When we're dealing with high-risk employees, we want to be able to help those individuals make behavior modifications. Those are the individuals who are going to cost companies the most money at the present time.
Also, in respect with that, the healthy employees, if they're not taken care of, they may be tomorrow's high-risk employees.
The health risk assessment showed that I did have high cholesterol. So it was very enlightening for me to realize that. because I thought I was in pretty good shape as far as blood pressure, cholesterol. I didn't smoke, anything like that. So it was very enlightening to realize that and to find it at such a young age. So now I can make the changes.
It pays to keep workers healthy, and corporations are saving millions each year through health and fitness programs developed by Johnson & Johnson healthcare systems. These programs are custom designed and can be as small or as comprehensive as desired, offering either fitness services, health management programs, or a combination.
Well, I think a wellness program is really very important to a company, but a company has to align their wellness program with a couple of strategic intents. One of those being, does it meet their business goals? Are they objectives they would like to meet with a wellness program? And if so, what is the culture like? Will this fit into the culture that they have? And then you also want to look at, well, if we have a wellness program, why? Why do we want to get out of it? Why do we need this program?
An employer that implements a worksite health and fitness program or a wellness program can see many benefits from that program. We look at reduced absenteeism, improved morale, improved productivity, and ultimately reduced healthcare costs.
This comprehensive approach includes the Johnson & Johnson staff to manage and provide services that deliver innovative programs which improve employee health and productivity.
Since the program started, I have gotten into a program of regular activity 3 to 5 times a week, coming in and working out on the treadmills and things like that. So before, I had a very low physical activity.
I feel great. Getting back in shape just makes you feel better, you sleep less, you're more active, you get more done. Well, I think it's just amazing that the company would step forward and bring a program like this for all the employees. This program's not limited to any special group. It's the entire company, all of those who like to use it.
If you want more information about any of the topics discussed today, visit our website at vstar.com. I'm Faith Daniels. Thanks for joining us. We'll see you next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.